Good morning and welcome to Valeo Physical Therapy. I'm Paul, one of the physical therapists and athletic trainer here at Valeo. This is Tony, one of our personal trainers. We're going to talk today a little bit about lateral hip issues and hamstring issues with runners. We've been seeing this a lot here recently where we have some runners that will come in and dealing with a high hamstring issue. What they're saying is a high hamstring strain, which may actually have more to do with the lateral hip. So what we're going to do here with Tony is we're going to check his lateral hip, see what's going on, and kind of give him some quick tips on how to get through this and kind of recover himself. It's not a substitution for medical care, so if something's not working here, you're not getting better pretty quick, and seek some assistance. All right, so first we're going to check his outside of his hip, and this is if you've got a therapist that can do this or someone that you feel confident they can do it. We're just going to bring his hip out into that position, and in this position here, his knee should drop to the table. Are you relaxed there, Tony?
I'm relaxed.
So Tony's nice and relaxed. You can see his knee's nowhere near the table, so there's probably something that we need to do. Now, if you're at home and don't have a way to test that, one of the things that you can do is you can test that kneeling. So get in the kneeling position right there, up nice and tall. All right, you're going to tighten the glute back here in this position. Your belly's going to be nice and tight. And as you're kind of leaning in this direction, if you're getting a lot of tightness here in the front of the hip or the outside of the hip, also a good indication that this could possibly work for you. So let's get to doing some treatment for it. We're going to start off with a foam rolling technique.
So we're going to foam roll the high part of the gluteal area all the way out to the side. So we're going to take 3 different positions along the way. Take that ankle across the opposite thigh. Roll 4 times, and you want to find that sorest spot that's in there. Once you find that, you're going to glide side to side 4 times, and then span, just rocking 4 times right over that spot. Now I'm going to lift the other side of the hip so I move out just a little bit, and again, 4 rolls, 3, 4, nice deep breaths while you're doing this, 4 glides, and then 4 spans. And finally, to get all the way out on that lateral hip, we're going to roll all the way out here. Now, a lot of times people try to roll their IT band to get that lateral straight, but this is where the muscle is. You want to stay up nice and high, that top 3 or 4 inches from the hip. And 1, 2, 3, 4 rolls, 4 glides, and 4 spans. Now, we're going to take that right into an exercise to make sure we activate the gluteal muscle. So going right into a bridge. Shoulders relaxed, using the gluteal muscles to bring you up off the ground, squeeze tight, hold, 6-second hold at the top, come down and release, and just repeat that about 10 times. Once that becomes an easy maneuver, then what you want to do is we're focusing on the right hip, so I'm going to extend the left leg and go to a single leg bridge and really activate that lateral hip. Now from that we're going to go into an integrated exercise and Amanda's going to help us. We're going to do a single leg deadlift. Key to this is your hips slide back slightly and your back stays flat as you come down. And then using that gluteal muscle to drive yourself back up into an upright position and back down. We're looking for about 3 sets of 10 reps, and that'll get the muscle turned back on.